You know, let's say I'm a hospital leader or a healthcare leader at an organization. Why should I put resources towards information governance? I mean, why does it matter?
And I think every organization, when they start this project, has to look at what's their ultimate goal. What is the issue that's causing them the most pain? What's their pain point? For some, it's patient safety. Well, patient safety, if you look at the issues that go to that, the root of that may actually be their Enterprise Master Patient Index. So if they have a lot of information of patients that's either overlaid two patients together or they've got two independent numbers, there will be safety issues.
I don't think many people see information and safety. You know, I don't know. Maybe they're starting to. But
I think they're going to have to, because these electronic records, I mean, it's probably the biggest investment that most organizations have spent, you know, is on these, and the investment payoff was to be that there would be alerts.
Access.
Well, and alerts, you know.
Yeah,
so in
true.
other words, if my weight's entered by nursing, and they better do it right. If they enter my weight, then when they order the medication, that should transfer to pharmacy. They should know my weight and they should get the right dosage. But if they've got the information wrong, and I'm Rita K. Bowen and it's Rita Smith Bowen, and they're actually two individuals, and they connect me with that weight, and she's 99 anorexic person, and it's obviously not me, then I'm not going to get the right amount of medicine. Or vice versa, someone who's possibly 300 pounds, you know, it's then going to the 99 pound, you know, it can have detrimental effects to the medication, especially in newborns. We've seen a lot of that for the information for these alerts coming through on those.
Well, and the drugs are so hard for newborns because of their size. So
Exactly.
definitely. So patient safety is one. I mean, is there financial implications? Are there regulatory implications?
Very much so, from a regulatory implication and financial implications when you talk about your billing and fraud and abuse. So you link it all together. If you've got information coming through and you can't trust the source, and you have cut and paste or cloning of information that's sort of out of control and it hasn't been monitored, you may be having information, and if your coding staff does not know that this is something that's been cloned or moved from another system and it's not re-authenticated and they code it, that's fraud, because it didn't happen in this event. It was just moved from this event. So there's a lot of implications that go with that entire process.
Interesting. I thought you were talking about stopping fraud, but you were saying that they could be doing fraudulent activities, which is its own liabilities.
Yeah.
Interesting.
I think another area that a lot of organizations, because of the whole I-10 initiative, and it's been, you know, kind of up on a cycle, whether it happens this year, we hope that it will, but if it doesn't, but many were trying to prepare for that, and they, you know, invested in computer-assisted coding. I still believe computer-assisted coding is the answer to I-10, because it will help facilitate a capture. It's still going to take eyes on it. But if an organization is trying to implement that and they haven't laid the foundation for information governance, they can't do it.
Yeah, the assistants will give you the bad
well, it's
result,
like,
right?
this doesn't work. Well, no, it will work, but your information doesn't work well with this. So it's basically the information governance is the content and structure of your entire organization's record, and it's building that trusted source so that everything works together in harmony and moves forward in that process.
Which, I mean, I think if I look at the future of healthcare, it's going to be built on the back of data, and in some ways it always has. I mean, we've always had the paper charts, so it's going to be really important.